Hello everyone, this is Dr. Abhishek Nagaraj. I'm a prosthodontist and implantologist with Ministry of Health, Riyadh, in the Kingdom of Saudi Arabia. Today I'm here to talk to you about dental innovations to combat COVID-19. Before I begin, let me thank Team ISG Implant Study Group for giving me this platform to connect with all of you and share knowledge about innovations. Our basic motive here is not to show about COVID-19 because most of you already know more than me about COVID-19. The main thing we are doing here is to help you understand what innovations can do in this kind of a situation. And I will give you examples of innovations that have been done in 5 key areas to combat with such situations and how to apply them. Okay, so welcome to the world of innovations presented by Team We Invent. Before we begin about innovations, let us discuss a case scenario. This is a case scenario where a small fragment of implant's abutment screw has lodged inside the implant. It has fractured and a small fragment is within the implant, as you can see in the X-ray. Now, there is a reason why we have to use special drills to remove this kind of a fractured segment of implant screw. Why? Because if we use conventional drills, we will harm the inside portion of the implant, the screw channels within the implant, that the implant may be rendered useless after we remove this fragment also. That's the reason we have to use special drills which will not affect the screw channels within the implant while removing of this fragment. Now the basic reason why I'm showing you this particular case is because here we can see innovation at different levels. What is innovation? Innovation is a solution to a problem. So is it a solution to the problem? Yes. But before we came to this problem, there was another problem. That was retention of processes, basically. So there was a discovery, a very important discovery, a scientific fact, without which we could not have come to this innovation. That discovery is osseointegration. Once we got to know about osseointegration, we found theories through which we could come to a conclusion that when we use implants, it may retain prosthesis without much problems. Okay, so we started using implants. But once we started using implants, like in any other field, there were complications. And to overcome these complications, we had to go through different levels of innovation. And we have come to this level where a claw drill with reverse rotation has been used. A little vibration was there, but mostly we could remove this screw fragment without any problem. So the first innovation here was implant based on osseointegration. The second innovation here was claw drill. We can see different levels of innovation here, but mostly the most important thing is applied science. Because without applied science, we'll never be able to reach this kind of a level of innovation. When we talk about innovations, what do we know about innovations? What exactly is innovation? Why do we do innovations and how to do innovations? Let me begin with what. The particular innovation of any field can be a solution to the problem which has been posed in front of you. It may be a product such as dental implant. It may be a process such as CAD/CAM process compared to casting failures to improve situation better from that. Or it may be a service, like when we had dentures, we came to come over dentures, implant retained over dentures after implants were innovated, or a hybrid denture. All this comes under service type of innovation. So innovation is basically a solution to a problem, but that solution has to be new and acceptable solution. Cannot be any solution. Why do we need innovations? We need innovations to solve problems. They may give you academic and monetary gains, yes. But the main thing is If you don't solve problems, what will happen is that you will be stuck with that particular problem and will not be able to move ahead. Let's take example of video games. When we come across a hurdle in a video game, we either use a cheat sheet or we try to come away or go around that problem, solve the problem. Without solving that problem or using a cheat sheet, we'll not be able to go ahead. Similarly, in life, whenever we face problems, we have to find a way to solve the problems rather than just sit there because you don't want to get stuck, right? And once you have found a solution to a particular problem, let us say it's a problem which is faced by many. So many other people will also ask you how you solve that particular problem. And when you tell them how you solve that particular problem, it becomes something used by everyone and everyone will appreciate your input on that. So it's not just for self, but to uplift the society also that we need innovations. How do we do innovations? See, the most important thing when we are doing innovations, it is that we should have sound basics knowledge. When the basic knowledge is sound, you can apply that science into various problems to find out the solutions. Yes. Second thing is passion. Without passion, without passion that okay, we have found a hurdle, we have to go further away from it. We have found a failed invention, we have to find a way across it, or make improvement in your approach, or try a different approach altogether. All this requires passion. That you don't stop where you're finding difficulties. Most importantly, one should have out of box thinking. Out of box thinking cannot be attributed only to people who have done masters or PhD. Out of box solutions come from graduates also. Out of box solutions come from even illiterate people in some fields. But the main thing is that they have worked so much in that particular field of their innovation that they feel there is a problem and they need to find a solution and they have to give a solution for that particular problem, which may be called innovation. The main thing of innovation, when you say an innovation, innovation may be of many things, many ideas. It's not that people don't have ideas, people have ideas all the time. But it has to be an idea which is novel. A novel idea meaning something which is new and non-obvious, which has not been tried before, or it is not like, okay, you have a road and you're going by that road. It is obvious that you will use that road. But it has to be a different road altogether, which would not have been thought by other people. So that is non-obvious. Then, once you have that idea, what would you do next? You need to protect your idea. The protection of intellectual property most commonly is done by patents and copyrights. Patents pertains to what we are discussing right now. Copyrights pertains to piece of art or literature or many other things, which can be modified but not copied as it is. So there are patents. Let's say patents, they are the ones which protect your ideas, profitability, or the commercial value of your patent so that no one else will take advantage of your idea. Especially important because you're going to a designer, you're going to go to a engineer, you're going to go to people to publish your article. If you don't have a patent application or if you don't apply for a patent before doing all this, your idea may be lost to other people who may have sinister um, objectives. So the main thing after you get a patent, you make a sketch of your design and you go to a designer and you ask him to make a 3D design and the STL files are formed. With the STL files, you go for prototyping. Prototyping is making a sample of your particular innovation. When you make a 3D printing or any other way of prototyping, that particular prototype will be used to do trials. Now 3D printing is a new topic altogether. It's a different topic. We can have a presentation on it at a later date if requested for it. So let's go to trials. Trials can be of two types, self-funded research or research grants. When you do trials, you may find that, okay, we have to change the design somehow, or we have to make difference to the prototype because this is not working. Okay, yeah, sure. Why not? So after you do trials and prototypes, and then again trials, once you have arrived at a final prototype, that particular final prototype is something of commercial value. If it has a commercial value, you can go for product enterprise, that is, you do mass manufacture and market the product, or you can go for patent monetization, that is, you commercialize your patent by giving it to a different company or a bigger company, which will handle the marketability of that particular patent. The another byproduct of research is publications, especially the one which involves innovation. You can go for original research publications in reputed journals. But the most important thing, as I said, is to mention that you have a patent pending. Patent pending means that other people who are looking at your piece of innovation will not be able to copy it without getting indicted. So I would suggest anyone who wants to do innovation or who wants to progress their idea into different fields, make sure that you have applied for a patent and then only proceed. And after you apply for the patent, wherever you're presenting, whether it's in a journal or in a conference or in a competition, make sure that you have written patent pending to your material. So here I would like to discuss a few innovations which have been done by us as in team We Invent, what these innovations are, and how we have proceeded with these innovations. Okay. If you notice on the corner or top corner of slide, the name of inventor is highlighted because we want to give due credit to the inventor. And on the bottom of on the bottom corner of the slide, you have a link where the particular product information will be available on our website. So this is, let's begin with decleft. It is an innovative method for feeding neonates born with cleft palate. What it has is basically an obturator type of plate which blocks the cleft area when a baby is trying to drink milk from it. Let's say this obturator is not present, the milk, whatever is being ingested in the mouth, will come out through the nose because there is a passage open here. So this particular idea was patented by us, and after patent, we went for several versions of this design. You can see the almost 7 types of 3D design here. And after designing and trying it out in patients, we have presented it in various conferences and publications. One of such publications was done by Dr. Ruchi Gupta, and presentation by Dr. Aditya Kapoor got us best prize in IndoCleft conference. This particular product is now available on our website. It is made of flexible, biocompatible material, and on order we also make different sizes of this particular product available. Next up is an innovation by Dr. Anubhav Jannu and myself. This particular invention called Kidwai spoon or reverse spoon feeding appliance has won national level awards at Innovation Awards at IDA conference, Indian Association of Palliative Care conference, and it has also won Dr. Chinwala Rolling Trophy from Association of Oral and Maxillofacial Surgeons of India in a national conference. So this particular innovation was basically made into a 3D design after patent, of course, and then we've made trials, initial trials of this particular innovation. We used samples or prototypes made of acrylization, similar to our natural dentures. At a later phase of this trial, we made these samples using vacuum casting for plastic, and it has done very good for so far. It was actually made as a replacement for Riles tube because most of the patients were feeling uncomfortable using Riles tube for longer term or duration outside the operatory area. Then comes our famous innovation called Reflect. It was invented by Dr. Akash Chakravarti. He has presented it in London and won World's Best Innovation Award in that conference of London. It is basically a mouth mirror which is having anti-fog function with LED. So basically the anti-fog function comes from a channel which carries the compressor air into the mirror, right next to the mirror, onto the mirror, so that the mirror has no water droplet or moisture present on the surface, so that the mirror is clear when you are doing any kind of operative procedure. Also, because of the better vision due to LED, the basic idea of this mirror was to reduce chair time, operative time, and as a byproduct, it reduced backache for dentists, which plagues dentists basically. So this was a design and this was patented, designed, prototype was made, as well as manufacturing and marketing was made by team we invent. This product, more details are available in this link. Any innovation, I've told so much about patents, yes, but patent is just a part of it. An innovation cannot be successful without a good design and 3D printing. Here is an example of innovation by 3D printing by Dr. Vandana Desai. This particular innovation, it has periodontal osseous defects in a 3D printed model. We've tried to include most of the osseous defects as much as possible within one model so that it can be studied and demonstrated. And it has been sought over by almost all states across India. It has been sought by periodontists all across India, and it has been distributed abroad also. It's called Van Perio after Vandana Madam's name and Perio model obviously. It was made by three basic steps of first we scanned the human mandible. It was scanned and made into a 3D file. Now this 3D file was refined and we added all the defects possible into this model. Each tooth of this model has different types of defects, periodontal osseous defects. So this model was 3D printed and is sold like this or distributed like this. How we came across this idea was it was basically inspired by an idea from Dr. Akshay Kumarswamy. He gave us the idea that we should make some periodontal model which can be used in the mannequin to do mock surgeries. Now, this particular model was a byproduct of that process when we came across that model and we thought, okay, this could be distributed. We have made it available in our website. Also, we are still continuing with the 3D printing and trials of the mannequin model, which will have soft tissue like this. It's a very thin soft tissue with almost 1 mm thickness and very good. It's almost real life soft tissue effect we see on this particular. This is a trial model basically. We are going to make the final one in about a month or so. The main reason why we need 3D printed models, why we are looking at 3D printed models, is because the 3D printed models, within the 3D printed models, the density of plastic or the bone which it simulates. So the plastic density can be controlled. As you see in this image, in this model, there is cancellous bone and cortical bone on the outside. We have cancellous bone on the inside and cortical bone on the outside. So it simulates nature of the bone and it's easy for mock surgery drills. As well as Now that we are making soft tissue, it will be easy to do graft procedures, flap raising procedures, suturing, etc. Another innovative idea was from Dr. Surabhi Mahidhar. For him, we've made 4, 5 different implant protocol models, including surgical steps as well as prosthetic aspects. All these 3D printed models were designed from scratch. All the parts have been made in 3D printed material, including the dentures and the implants and the sinus material. So you can practice over dentures, you can practice sinus lifts, you can practice all the prosthetic parts like all-on-4 with angled abutments, and most importantly, you can actually demonstrate it to the staff in your clinic as well as you can show it to the patients when you're describing them the treatment plan. This particular model, all these models are available on our website at this link. The most important thing what I want you to notice here is that all our inventors or scholars, they're from different backgrounds. They're from different branches, different backgrounds, but they all have one thing in common, that is they want to make a positive difference in their chosen field. So now let us move on to the hot topic, COVID-19 specific dental innovations. The main key areas I want to talk to you about in this particular area is personal protection, patient protection, clinic alterations, advancing ahead, that is the future scope, and upgrade of medical facilities within dental clinics. As we all know, COVID-19 is here to stay, and dentistry is considered one of the dangerous professions considering the method of spread of COVID-19. Now, whatever has happened, but in our practice, unless we bring into effect permanent changes, we are not going to be able to combat this kind of a pandemic, whether it's this time or any other future time. So I have tabulated what I feel are the 5 key areas, items which have been innovated by us and outsiders in these 5 key areas. Other than that, if you feel there is any new idea or new addition which can be made to this list, please let us know. We are also thinking of floating an Excel sheet or a Google Forms online sheet, which we will be able to access through the links, and we will give you the links as well. And you can access that sheet and add whatever steps or measures you want dental clinics to take to combat, as well as you can read from that link all the material or whatever has been posted so that there is a common ground of understanding between all the dentists. So first key area I want to discuss with you is about personal protection. Why do we need personal protection? Personal protection is very important because unless you stay healthy, you will not be able to treat your patients. Unless your staff is healthy, they will not be able to support you. Now, we have seen a lot of messages and images of face masks being used, respiratory masks being used. We have also designed respiratory masks, yes. It has a filter which is made of carbon. It is available in our website at this particular link. The main reason why we made a respiratory mask like this is one, shortage of N95 masks, or it's too costly and it cannot be reused. The second reason is that we can sterilize this kind of a mask. It is a flexible mask, if you see. It is a flexible mask. It has a carbon filter inside and it has a cover. This carbon filter can be removed and washed. This material can be sterilized. This material can be sterilized. All this can be sterilized. So you have a mask which can be sterilized and reused over a period of time rather than spending so much on one particular mask which is disposable. Now, NHS from UK, they recommend that all dentists should use a respirator type of mask. Plus, On top of this mask, we should use a disposable mask so that after every patient, we dispose of that mask and we use a new mask to protect this mask as well as protect ourselves because we are reusing this mask. Okay. So the next thing I want to talk to you about is protective shields. Again, we have seen many designs of protective shields, especially 3D printed ones. This is the one which has been made by us. It is very easy to use, yes. But the main feature in this particular mask, I mean face shield, is that this particular sheet, it is not something provided by us. It is provided in bookstores all around the world. It is made of this transparent sheet, transparent files, which are available in bookstores. So you don't have to wait for a dental distributor to provide you this sheet when it gets over, because they are going to be in shortage. And secondly, when you attach this to the 3D printed framework here, this particular this particular hole, it is made by punching with regular punching. It's a regular punching device of papers for filing system. So the main advantage here is that you can make your own mask, do it yourself kind of a thing, which will be easy to handle as well as it will be available all the time by anyone who wishes to use. Of course, it has to be combined with head caps and it has to be combined with the the scrubs which will protect your neck area. This file itself is big enough to protect most of the stuff, but yes, you have to completely seal it and you'll need some kind of equipment for that. Most of the scrubs which are being marketed, they have face cover incorporated in it, but we are making some kind of attachment which can be used along with this kind of protective shield to use with the scrubs so that everything from head and neck region is covered. Next thing I want to talk to you about is aerosol evacuation. Now, there are many aerosol evacuation machines available online. Yes, many ads I have seen. They are very costly, about 70,000, 50,000, let's say, in general, minimum 50,000. It's good for some high-end clinics, but even high-end clinics have multiple chairs. You cannot provide each chair one machine unless you're doing that level of practice. So what I mean to say is that aerosol evacuation machines cannot be accessed by every general dentist. So we need to innovate in that. Yes. There are three methods which I feel is the way to go for aerosol evacuation. The first one is by using wet and dry vacuum cleaners. These vacuum cleaners can be attached with special tubes to attract the aerosol right next to the dental chair. Then there are two more methods which I cannot disclose right now because they're patenting it, and probably by the end of this week or next week we'll be able to disclose those. So if you want any kind of further info on these, we will keep it within 5,000. That is what our range is of marketing. So more or less, we will keep it within 5,000 for each of those evacuation attachments, and they can be attached to the sources which you already have in your clinic. So you don't have to purchase anything extra other than that. You can like our Facebook page or you can follow us on social platform. We will be able to update you as soon as possible, or you can even mail us on that. Next thing I want to talk to you about here is patient protection. It is similar to personal protection in many ways. Yes, patient protection, it overlaps personal protection. But the main thing I want to talk to you about here is mobile dentistry. That is, we should make mobile dental clinics accessible for highly susceptible patient groups, that is, geriatric patients, children, as well as palliative care kind of patient who are highly immunocompromised kind of patients who will be at risk, fatal risk if they visit a clinic which has been contaminated. So that is one thing. The second thing is barriers. We use these every day in our clinics here, but I have never used this during my PG days or during my practice in Bangalore because we never got to know about these in those days. But now that we have so much information and we have a situation which has to be controlled right now, in future I hope everyone purchases these kind of barriers which are disposable, which should be discarded after every patient, and they will be put in the most commonly touched areas such as buttons and the handles of the lamps, handles of the X-ray tubes, even your special disposable instruments. So mostly what I would like to say is that when you put barriers on these kind of handles and the places where patients are most often or even the dentists are most often going to touch these areas, it should be discarded. That gives better protection, almost 99% of protection from such kind of communicable diseases. The next key area I want to discuss with you guys is clinic alterations. We have many innovative ideas which are surfacing, such as door handles, rack openers, tube dispensers, etc., which will be effective in reducing contact and unnecessary touch of possible contaminated areas. Secondly, we have air purifiers and dehumidifiers or humidifiers. There is a there is a research which says that relative humidity has to be between 30 to 60. That is the best way to reduce the virulence of the virus. But it still has to be countered or researched a lot more. But basically, we need to keep air purifiers which are good enough uh, for a clinic environment, as well as dehumidifiers, which will help us to maintain the environment of a clinic in better way. Then there are disposable equipments. Disposable equipments such as mouth mirrors or camera pouches or any other equipment which is possible to be made into a disposable equipment should be used rather than reused. Even impression boxes. Why impression boxes? Because it reduces the damage to impression as well as it reduces the cross contamination between the lab and the uh, dentist. When you actually use impression boxes, you can immerse them in cold sterilization techniques without any damage to the boxes. Then we should have, this is an example of a disposable mirror. Actually, when we introduced this mirror, every marketing agency was like, why did you make a disposable mirror? Because people like to use reusable mirrors. And we were like, this is the standard all over the world. But it doesn't work out in India like that. Sure, now we have to move on to more disposable equipments. We have to change our mentality and work towards using more disposable equipment. The next thing I want to talk to you all about is individual chambers for each chair. Why it is required? So that we give sufficient interval for the evacuation machines to work between each patient so that there is reduced spread of disease. Advancing ahead, we need to embrace the good things about digital dentistry. Even though it is a bit costlier than your regular impression material, you need to invest on intraoral scanners. You need to work on digital platform that will reduce cross contamination to a great level. There are robots, dental robots, which are seen on various publications. But giving a robot autopilot kind of a mode in this kind of era where microdentistry is more important, I don't think it is going to work out so easily for us. Rather, robotic assistants, will be much more helpful to reduce the load on our stuff, as well as nanorobots. Nanorobots are the ones which are purported to remove caries, do restorations, oral hygiene measures, as well as even in bleaching. So these should be employed so that we reduce the aerosol type of procedures. Then there is guided surgery. Why guided surgery? To reduce the chair time, to reduce as much as possible, we should reduce the time to reduce exposure to infectious diseases. Then there is a practice of cadavers still, and I would suggest to use study models or even realistic models which can replace cadavers or animal carcasses. It will help in a great way to reduce infection spread of infection. Then we are patenting one way of immediate prosthetics. It should come out soon, but immediate prosthetics also reduces the chair time and the contact between patient and the dentist, as well as it helps in many other areas also. There are multiple advantages of immediate prosthetics. So one should embrace such kind of theory or practice, which will help us to do better service to the patients as well as protect ourselves. This is a far-fetched conclusion. I would like to propose because I feel a dental clinic is very close to be able to upgrade it to with medical facilities. Why? Because compressors, let's say we have the greatest number of compressors suitable for medical use right next to any respiratory ICU in a hospital. That is the first thing. Ventilators, which are powered by these compressors, are being shared in almost every platform which talks about COVID-19. Okay. Oxygen tanks are available. They are all available in many dentists clinics who are using sedation tech. So that's another plus point. Dental chairs with medical sensors are also available with select markets. I've seen one in Bangalore, a particular dealer in Bangalore who have dental chairs with medical sensors fitted to them so that the medical parameters of the patient can be monitored. So it's a good thing. It's a good plus if you want to upgrade to medical facilities, at least at a certain level, so that if, let's say, things become more worse than what they are, we will be the next. We will be the first line of defense, right next to the surgeons or the medical professionals who are battling COVID-19 right now. Most importantly, I would promote all the dentists to do basic life support BLS training. If they can do advanced cardiovascular life support ACLS, and definitely procure medical emergency kits within there are dental emergency kits available. Dental medical emergency kits for dental clinics are available. So you should procure them and keep them ready for whatever fatality, whatever eventuality may come in future. The basic idea is to make everyone be safe, especially dentists, because it is under very highly susceptible professions for this kind of disease. It should be safe to practice. This is another website of ours which deals into making 3D printing available for mock surgeries as well as for uh, surgical guides. And there is another website which we are now building, almost completed, to make commercialization of patent easy for individual innovators. So if you have any idea, see the main thing is that people have ideas. It's not like people don't have ideas. The reason why we don't have so much innovation is because either they don't know how to go about that innovation, how to bring that idea or a concept into the market. The first reason. Secondly, so many people don't follow through their idea. They just forget about it or they think they will be doing it at a later date. Today's technology cannot be used in tomorrow's world. I mean, most of the technology which is being used today, like we had CDs before, we don't have CDs anymore. We had pages before, we don't have pages anymore. So there is a life for every idea. If your idea cannot be utilized at this particular time, it may not be the same idea or the same value at a future date. So don't delay your ideas. If you have an idea, be forthcoming, approach companies like us, which will help you to promote your ideas to a different level. So what I was talking about, Kidwai spoon, this is now 3D printed. We have mouth masks 3D printed, we have decleft which is 3D printed, it's an obturator which I showed you before. So all these ideas have been available to us right now at very economical cost because of 3D printing. In future, I hope it will be more economical, but the technology will change, and technology change is a major challenge for any innovation to survive. So I would suggest if you have any ideas, please approach us. I would like to thank Dr. Girish Rao and Dr. Anand Krishna. They are very good mentors, the best I have seen till date. I want to thank them for giving me this platform to talk to you all about our innovations and how to do innovations. We want to inspire innovations. That was the main idea of this presentation. Then I want to thank Dr. Ranjani Rao and Dr. Megha Rao for providing us the IT support, technical support. And I want to thank Dr. Ruchi Gupta for being my co-editor in this presentation. And I want to thank all of you for listening to me with so much patience. On behalf of Team We Invent, thank you.